BC's two top doctors are on the defensive tonight after leaked documents raised questions about government transparency and how it's providing support for the neighborhoods hit hardest by the pandemic.
Dr. Bonnie Henry is doubling down, but her second-in-command insists that changes are coming. CTV's Penny Daflos has been digging into this. Penny, you asked the province's top health officials about these leaked reports. What did they say?
Well, and make no mistake, they were leaked to journalists. The head of the CDC insists it's no big deal that they've been made public, but the documents clearly say they are authorized for internal public health use only and not for public distribution.
A variety of vaccination clinics and registration drives are now underway in Surrey, where officials have long since said infections are high. But for the first time, we're finding out exactly where and how bad. First leaked to Postmedia's Vancouver Sun, internal BC CDC documents outlined the Lower Mainland's worst COVID hotspots in neighborhoods like Bridgeview, Newton, and Surrey City Centre. Another map shows, in contrast, they have among the lowest vaccination rates.
And I can tell you that there's very low level of hesitancy there.
The South Asian COVID Task Force points out many people haven't realized they're living in hotspots and are eligible for vaccines or know how to get one.
We need to have more collaboration around the data that's clear and transparent. We need the leadership to understand that there's people at the bottom, boots on the ground, that can help.
Until now, public information has been regional without neighborhood-level detail, in contrast to Alberta and Ontario, for example, where people know how many cases and vaccinations in their immediate area.
They don't trust us to have access to the same information that they do. It's paternalistic. It's frankly insulting, and British Columbians deserve to be treated like adults.
It's public data. Health authorities or public health are stewards of those data, but it's citizens who, were tested and who have their addresses.
We have been providing information as cases increase so that they can't be identifiable by local health area.
None of the pages indicate the leaked documents are a draft, but health officials claim they weren't ready for publication.
It wasn't yet of the validation or the standard that we were necessarily ready to put it out proactively.
Neither the CDC nor the Ministry of Health has ever published that level of detail, even as restrictions tightened during a third wave that's seen hospitals at capacity with COVID patients.
The public is being asked to make a lot of private decisions that impact transmission around our social gatherings and contacts. The public hopefully can continue making good decisions and can understand the rationale.
So, Penny, a central question coming out of all this: are health officials committing to being more transparent in the wake of this?
Well, that's exactly what I asked them, Scott, and they say so. And when I asked if it would be the same level of detail as the leaked documents, Dr. Gustafson answered with an emphatic yes and insisted that staff have been very busy up till now. Of course, they could have been just making public the reports that they get rather than stripping away information that they do publish. But they did call in more information, the goal they're trying to get to in the coming weeks. So we'll have to wait to see what that actually looks like, Scott.
All right, thank you, Penny. And to look at that CDC report and see a detailed breakdown of transmission rates and vaccination rates in your neighborhood, go to our website, ctvnewsvancouver.ca.